Hello everyone. Nowadays, we are seeing some of the newer anti-obesity medication discussion everywhere, like semaglutide, tirzepatide, etc. But the thing is, many people, even doctors, will not be ready to accept the benefits of these newer molecules because it's a common nature of human to deny the newer things initially. Slowly, as the days pass on and as we gain experience and confidence in these medications, there will be acceptance. And in this situation, we commonly see the argument in favor of lifestyle interventions. See, the thing is, lifestyle intervention is very, very important, which obviously cannot be ignored. But what we have to know about lifestyle intervention and the medications, that we will discuss in today's video. First point which we have to remember is a very important physiological sentence, that is, obesity protects obesity. In the sense, if you observe in this graph, see here, with lifestyle intervention, for example, we will be following some proper diet and exercise, all these things. What happens is, there might be weight loss if we are following it up, right? So, if you observe here, during that point of time, when there is weight loss, there are some other physiological changes happening in our body. For example, as the intake, the green line has a dip here, as intake reduced and weight loss is obvious, there will be also reduction in the energy expenditure by the body. That will lead to reduction in basal metabolic rate, this red graph what we are seeing. So all these things will come down. Along with that, in our body, there will be some hormonal changes as well. For example, ghrelin will start increasing and leptin will fall. We all know that leptin is a satiety hormone. So if its level falls, there will be reduction in satiety and counter-regulatory increase in the hunger. So obviously, the individual will end up in increased hunger and increased preference to calorie-dense food. So these are the changes which are happening naturally, physiologically in our body whenever there is weight loss with lifestyle intervention or through any other mode. So all these changes might end up in, again, regain in the weight. So this is what that sentence actually means. Obesity protects obesity. You might have seen people will be following some diet and exercise for quite some time. They will see the result, but after a period of time, they will not be able to cope up with the hunger or the cravings for energy dense foods and all. So those will end up in regaining the baseline weight again. This is very common scenario all of us might have observed. So how does the medications which we are focusing so much nowadays will help in this particular physiology, that we will see. We have noticed there will be weight loss, right, with all these changes. So these pharmacological agents will reduce ghrelin and they will increase leptin. As I mentioned, leptin is a satiety hormone, right? So that will lead to what? Early satiety, and that will reduce the hunger. Also, they will increase the energy expenditure and they will take care basal metabolic rate will not reduce to the greater extent, so that all the energy will be preserved in the body, leading to weight gain. Instead, there will be lesser reduction of metabolic rate. So overall, reduced hunger, increased satiety, and maintaining a proper basal metabolic rate, all these mechanisms will help in maintaining the sustained weight loss, which was not happening with just lifestyle interventions. That's why these medications are very helpful in maintaining sustained weight loss. This is the first thing we have to explain to those who are reluctant with these particular medications. If you observe, see here, there are numerous anti-obesity medications. So the percentage of weight loss with all of these drugs and lifestyle per se, we will see now. If you focus, all those older medications which we consider as first generation anti-obesity medications would lead to hardly 5 to 10%. We can consider 5 to 8% of weight loss. You can observe here till this level, all of these were there. And if you focus on this lifestyle, it will lead to up to 3 to 5% of weight loss, right? But when we consider the newer medication, that is second generation anti-obesity medications like semaglutide and tirzepatide, we can clearly see the weight loss of about 15 to 25%. This is quite a significant reduction in weight that will help in improvement of a lot of conditions which have developed because of obesity. This benefit we will see in the upcoming slide. See here, this slide focuses upon the health improvements which we can see as per the magnitude of weight loss. So in this case, we can see clearly what are the changes which are going to happen at 3% weight loss, at up to 5% weight loss, if the weight loss is up to 10% and 15 or more. See, whenever there is 3% of weight loss, we can see a good improvement in blood glucose and triglyceride levels, right? Which we can achieve through lifestyle interventions or using some anti-obesity medications. When it comes to reduction in weight loss by up to 5%, we can get the benefits like improvement in HDL cholesterol, reduction in systolic and diastolic blood pressures, even hepatic steatosis will start improving, and there will be improvement in the quality of life in multiple ways. So this is seen when the weight loss is up to 5%, again, which might happen with lifestyle interventions along with the anti-obesity medications, right? But when it comes to 10 to 15% or even more of weight loss, lifestyle alone will not help to such extent. So we have to utilize the newer anti-obesity medications, semaglutide or tirzepatide. So in that case, what happens is even the OSA will improve, and if the individual is having NASH, that also will show improvement or reversal, that we can say. And if the weight loss is more than 15% from the baseline, we can even consider remission of type 2 diabetes, reduction in cardiovascular events and overall mortality. Here again, people will start discussing type 2 diabetes is not at all reversible. The point here to understand is we are not speaking about the reversibility of illness. We are speaking about the remission. That is, we will get that individual in such a state that the disease is very well controlled, and whatever the risks or the complications are related to that particular disease will come down to the same magnitude as that individual who is not having type 2 diabetes. So these are the advantages of utilizing newer generation anti-obesity medications along with lifestyle intervention. Hope you have understood the clear benefits of these molecules along with the lifestyle. Both should go hand in hand. If you have any doubts, put it in comment section. We will discuss it in detail. Thank you so much.